Hello everyone, my name is Evangelos Christou and I'm a doctor. I'm a dermatology registrar at Evangelos Hospital in Dundee. And today I'm going to talk about how safe is Far-UVC exposure for patients with photosensitivity. And I'm talking on behalf of the Scottish Photobiology Service in Dundee. So as you all know, Far-UVC is a germicidal UVC radiation with a typical wavelength between 200 and 230 nanometers. And the common source of Far-UVC is the krypton chloride exam lamp, and there is a primary emission wavelength of 222 nanometers. And there is also a low residual emission throughout the UV region of the electromagnetic spectrum. Several experiments, laboratory have shown those germicidal properties of krypton chloride exam lamps, and that can inactivate bacteria, viruses, including the COVID-19 virus. Also, studies in animals and healthy human models have demonstrated that krypton chloride exam lamp does not pose any long-term adverse skin or eye effects. However, it has not been assessed whether Far-UVC poses any risks to patients with a photosensitive disorder. To those that are not familiar with dermatology or photodermatology, photosensitivity disorders is a heterogeneous group of skin disorders that are characterized by abnormal skin reactions to wavelengths of light within the solar spectrum. Typically, we see that to UVB, UVA, and less frequently we see that to visible light. And the patients mainly manifest and they have symptoms of skin inflammation and signs of dermatitis, hives, blisters, and in some rare disorders we can see also increased risk of skin cancers. Also, those patients also can have systemic symptoms, and they can feel unwell, they can have fatigue, headache. And those disorders are classified in 5 major categories. So we have the idiopathic that have an immunological pathogenesis. We have the photoaggravated dermatosis, which means that the patient has a skin disease, a dermatosis that becomes worse, it's aggravated by sun exposure. We have the drug or chemical photosensitivity, metabolic, and genetic photodermatosis. So overall, these conditions are common, mostly because the prevalence of polymorphic light eruption, or PLE, is very common. PLE is the most common idiopathic photodermatosis, and it has an estimated prevalence of 10 to 20% in Northern European and in North American populations. And the top right photos, and you can see a photo from a patient with PLE on the face. And usually 1/3 of the patients also have reduced minimal erythematosis to UVA and or UVB. And this group of disorders also entails some more some very severe but rare disorders that can be highly debilitating, such as chronic dermatitis or CAD. CAD is a persistent photo-induced eczema that affects only the photo-exposed skin. And as you can see here on the photo, it spares the covered skin areas and or for example here below the neck or under the chin. And CAD patients also can have predominant UVB sensitivity, and also they can have UVA and visible wavelengths involved. Another very severe photodermatosis is solar urticaria, which is a rare variant of urticaria, and patients develop acute photosensitivity within a few minutes of sun exposure. The top right photo is from a patient with SU, and you can see the erythema that developed after 2 minutes of wintertime sun exposure. And you can see the sparing on the distal part of the fingers, as well as where the waving green was. And those symptoms can be induced by exposure to UVA, UVB, or visible light. Lastly, a very important group of conditions that, although they're rare, it's important not to miss them, are the genetic photodermatosis and the dermatosis that have a genetic predisposition, such as xeroderma pigmentosum and porphyria. And you can see here the back of a patient with xeroderma pigmentosum with several atypical moles and scars from previous skin surgeries because of skin cancers. And this is a photo from the back of the hand of a patient with bullous porphyria, and you can see the blisters, the marks, and the post-inflammatory pigmentation. Therefore, it's of critical importance to do photo investigations, or appropriate photo investigations in patients with suspected photosensitivity. And the photobiology unit in Dundee hosts the Scottish Photobiology Service, which is a tertiary photodiagnostic service to investigate and diagnose individuals with suspected photosensitivity. And here are some examples from abnormal photo testing from patients with photosensitive disorder. On the left is a photo from a patient with chronic actinic dermatitis, and I hope you can see the abnormal visible skin changes on monochromatic photo testing, and the different circles correspond to different doses at a specific wavelength. The top right photo is from a patient with solar urticaria, and you can see the hives on monochromatic photo testing. And the top and the bottom right photo is from a patient with polymorphic light eruption, and you can see the abnormal response following the broadband UVA provocation testing. Regarding Far-UVC now and its effects on human skin, in 2022, the Dundee Photobiology Unit undertook a clinical study and to evaluate how the effects of Far-UVC on human skin in healthy volunteers. And the results of this study were that there were no visible or histological changes and this was with skin biopsies at single Far-UVC doses of 2,885 milliliters per square centimeter, which was delivered from the filtered krypton chloride lab, or to repeat exposure doses of twice daily 1,443 milliliters per square centimeter over 4 days. And therefore, the natural extension of this study was to investigate whether Far-UVC poses any risks to patients with suspected photosensitivity. Therefore, we performed photo testing with Far-UVC in the form of a filtered krypton chloride examiner lamp, which you can see here, which was introduced in our routine practice in January 2024. And the testing was because Far-UVC is increasingly being deployed in public places, and it's important to know whether photosensitive patients will have any issues with that. And the testing involved the position of the filtered of the lamp at 20 centimeters from an area of skin, typically was the back, and a doubling dose patch was placed, and the 4 square sections of the skin were exposed to 6, 12, 18, and 23 milliliters per square centimeter. And these doses were related to the exposure time of 13, 23, 34 and 43 seconds, and the top doses were equating the current UK maximal daily exposure limits. And then the skin areas were visibly assessed at regular intervals in the same day and also the next day by experienced clinical assessors. And here are the results. So overall, we 49 patients received Far-UVC photo testing, and we found that there were no visual skin changes in any individual tested with Far-UVC up to 23 milliliters per square centimeter. More specifically, if we look on the table, the most common condition that we tested was polymorphic light eruption or peeling, and this accounted for more than 1/5 of the patients. And then the second more common tested disease was CAD, followed by solar urticaria and photoaggravated atopic eczema. One patient had actinic prurigo, which is a rare photodermatosis with a genetic predisposition One patient had both PLE and chronic actinic dermatitis. One patient had a form of porphyria, and one patient had both PLE and photoaggravated atopic eczema. And finally, 6 patients had UVA and/or UVB sensitivity, and 6 patients were not light sensitive. You can see here in this column the results of the photo investigation and whether the patients were sensitive to UVB and/or to UVA, or if they had normal responses. And we also calculated an index that measures how many times a patient is more sensitive at a specific wavelength compared to the normal population. And here again, you can see that all patients had normal Far-UVC photo testing. Just to focus on the more severe photodermatoses, such as chronic actinic dermatitis, you can see that patients who were up to 18 times more sensitive than the normal population, for example at 335, had normal Far-UVC photo testing. And also another, in solar urticaria, there were patients that were sensitive up to 120 times compared to normal population, and they also had normal Far-UVC photo testing. So overall, in our cohort, none of the individuals with abnormal photosensitive disorder had a reaction to Far-UVC photo testing, and the doses were within the recommended exposure guidelines. So those results are reassuring, and demonstrate that Far-UVC does not pose any increased risk in patients with photosensitivity. And we will continue to perform Far-UVC photo testing in our unit throughout 2024 to determine the safety of Far-UVC. Thank you very much, and I have to take